All right. Hello, everyone. Good evening. I want to welcome you to our Doctor of Physical Therapy information session. This is where you have the opportunity to learn as much as you can about our college, our university, as well as the Doctor of Physical Therapy program. You'll also get some inside scoop from one of our current students to kind of give you a student perspective. And of course, we have a faculty representation joining us as well, who can definitely give us more insight on the program itself, its design, its outcomes, and so forth. And then we also have me, who's the admissions counselor. And so I will be kind of going over the requirements, the admissions part of the whole process. So I'll start with introducing myself. My name's Tammy Trainer. I'm the Assistant Director of Admissions for MCPHS, and I work closely with um, the School of Physical Therapy. There we go. Okay. Now everybody should be able to see my screen, right? All right, perfect. All right, so let's have Dr. Hune, if you can introduce yourself.
Hi, everyone. My name is Dr. Karen Hune. I am the program director for the graduate phase of the School of Physical Therapy, and I look forward to answering your questions.
All right, and our student representative, who is also an admissions ambassador. You can introduce yourself.
So my name is Jordan. Unfortunately, I do not have relations to Dr. Hune. I am a second year physical therapy student. I have lived both on and off campus, and I've been in Worcester for just about 2 years now. And I'm relatively local. I'm from Rhode Island. So any questions about in-state and out-of-state activities and differences, things like that, I'm your girl.
All right. So I want to give you just a quick warning. For some reason, my Zoom has not been cooperative today. And so my face has been going in and out of the picture. So if you see me disappear, but yet you're still hearing my voice, don't panic. It's not a trick or anything like that. It's just the technology today has not been its best. So before we begin, a little housekeeping. At the bottom of your screen, you're going to see something that says Q&A. This is where we would like for you to place your questions as we go throughout the presentation. And then at the end of the presentation, we will address each question. We encourage you to ask as many questions as possible. That's the whole purpose of this event. And we hope that you walk away with a better understanding of who we are and what the DPT program is all about. All right. So I want to start out by talking about us and did you know? So I don't know how many of you knew that we have 100 programs spanning the healthcare space as a comprehensive healthcare university. When I say comprehensive healthcare university, basically that just means that every single program on our at our university is healthcare based. We are healthcare focused. So 16% of employment in healthcare occupations is projected to grow from 2020 to 2030, much faster than the average for all occupations. So this is definitely the occupation for longevity, so you definitely want to keep that in mind. We just celebrated our 200 years of preparing future healthcare leaders. We've been around since 1823. Yes, I'll repeat that, 1823, as the oldest university in Boston and the second oldest pharmacy school in the country. Wow, you talk about longevity. That definitely says a lot. And as far as our student population, right now we have a little over 7,500 students that are enrolled from all 50 states, as well as 74 countries. So MCPHS definitely values diversity. And then when it comes to clinical affiliations, did you know that with world leading medical institutions, we are associated with Brigham and Women's Hospital, Mass General Hospital, Boston's Children's Hospital, and the list goes on and on and on. And if I was to name all of them, we'd probably be here till 1 or 2 o'clock in the morning, and that's not something we want to do. That just goes to show you that we have affiliations all throughout the country. So it's a little fun fact. All right, so why MCPHS? Well, first of all, if you look at the very top, I mean, this speaks volumes. We are #1 for university earning power, #1 in the nation. So MCPHS reached the top of the Wall Street Journal Times Higher Education College Rankings list, surpassing the University of Colorado, Denver, Georgetown University, and Harvard. MCPHS graduates are trained for high-paying careers in high-demand fields. So that is something we are truly proud of, and it's definitely something that we want you to know. We're #3 in the country for value. A study by Georgetown University has ranked us as the third best institution in the US for economic value that it provides to its students. And then we're ranked #4 as most transformative when you start to look at our graduation rates and our earnings. We are ranked 4th among 700 plus United States universities. So MCPHS has definitely placed our footprint not only in New England, but throughout the country. And we continue to make those strides to be the very best and to give you the best return on your investment. All right, so let's talk a little bit about Worcester, where our Doctor of Physical Therapy program is held. So I want to turn to Jordan because this is definitely not a monologue by any chance, because I want you all to jump in, both Dr. Hune and Jordan. Jordan, tell us a little bit about Worcester. What is it like being a student in Worcester? Tell us a little bit about the city.
So I personally compare Worcester a lot to Providence because I am from Rhode Island. It is a very up and coming city. It has really honestly gotten a lot better over the course of a couple of years. Down by Kelly Square, you have Puller Park, which is where the Worcester Red Sox play, and that has brought a lot of good things into the city, in my opinion. It's definitely a foodie city. I forget exactly how many restaurants there are, but there's like over 400 different restaurants in Worcester alone. It's really amazing to be a student here because there are so many opportunities. Like you do have all of the hospitals so close, like St. V's, UMass General, and we are pretty close to Boston as well. It's only about an hour away, so you have all the opportunities there. And I personally really like being in Worcester. My roommate is originally from the area, so she takes me to like all the fun spots. Too bad she's not on this, but it's on. I love being in Worcester. It's amazing.
Good, good. Thank you for sharing that. Now, Dr. Hugh, I don't know, are you living, like you've been in Worcester all your life, or you tell us about that? I think you're on mute.
Sorry, I have moved quite a bit. I have only been in the Worcester area for about 6 months, 7, 8 months. I moved down here from Maine. And I like being back in civilization. I find Worcester to be a very welcoming and well-placed small city. So in 20 minutes, I can be at this place that I love, the Shops at Blackstone, which is all the great shopping, Athleta and Nordstrom, everything is there in 20 minutes, where I can stay in town and walk and find little crafty shops. There's a great plant store, and there's all, so it's a great mix of being close to big stuff and yet being in a small, very walkable city. I walked 1.5 miles yesterday to go and get a massage from campus. So it's a very nice small city with access, and skiing's 20 minutes away too. So to me, it's perfectly placed. We're an hour from Boston. We're probably only an hour from Providence. We're less than an hour to Connecticut. So it's to me, it's a very well-placed city.
Oh yeah, and we're finding that to be the case. That a lot of people are noticing that living in Worcester is definitely a lot less expensive than living in Boston, and so people are starting to move here and make that commute. But thank you both for sharing your perspectives on Worcester. It is the second largest city in New England. As we mentioned before, very diverse population because there are 11 colleges and universities in Worcester alone, 11. So it is so like easy just to see a bunch of students walking down, a street of any of the streets in Worcester. So colleges are everywhere, very college oriented city. All right. Now let's talk a little bit about housing. I am so excited that even for this graduate program, we offer housing. And when I say housing, I want you to get rid of that picture in your head of the cinder block room where there's like two bunk beds and it's only a tiny little space for you to place your feet. That is not the type of housing I'm talking about. So if you look at our presentation, you'll see that we have studios, suites, condos. These are all in close proximity to the main campus. Not only that, but you have 24-hour access to our fitness center. There are cafes, study spaces, computer labs positioned throughout the entire campus. What's really important is that it's affordable. All of the housing is competitively priced. And so what we did was we went out into the city of Worcester, looked at the prices that are going now for apartments, and we wanted to make our prices much lower. So you'll definitely find that. Also, you will be happy to know that they come fully furnished. So the couches and the chairs and the tables, all of that comes with the apartment. Rent is charged once a semester. You'll have your parking spot. And so, turning back to Jordan, I know that you lived on campus at some point. Can you talk to us a little bit about that?
So I lived in one of the studios available my entire first year of the program. I always highly, highly recommend living on campus for at least for your first year or first semester, because during that initial period, it's very vital to like make friends and expose yourself to all these different people. And I feel like you kind of lose that when you commute. My roommate, for example, she lived like 30 minutes away, so she feels like she missed out on some of those experiences where me, I was literally right there on campus and I had an amazing experience my first year and like made so many friends. Study groups are really easy because then you just walk over to the study group wherever you have it and you have a nice tight-knit community where you're able to get your questions answered, practice with each other, but then also you're able to go out after class and like have decompression time and family bonding, we call it time. So I feel like it's very like it is a good thing to live on campus, especially for your first semester or your first year. It is also good if you're coming from a further away area and you don't have to worry about getting furniture or bringing furniture or what are you going to do with it when you move out, if you do choose to move out. So those are just like a couple of good things about it.
Yeah, I love the furniture part. I mean, who wants to carry a table, up a elevator or stair? So the fact that it comes fully furnished is amazing. And if you want to see what some of the studios and the suites look like, I encourage you to go to our YouTube channel. If you would just type in MCPHS, Worcester Housing, or just housing in general, you'll get to see various videos of us showing you the inside examples of some of these suites and condos. And so that will give you a better understanding of what they look like. We also have housing actually inside of the building where physical therapy classes are held, and that's the Lincoln Building. The If you come to a campus tour, you'll be able to actually see an example of that type of room. It's definitely more of a hotel style room as opposed to a condo or suite, but we try to provide opportunities for everyone so that way you'll have some choices. All right. Now let's move into talking about an interprofessional community. So if you look at this slide, you'll see that our doctoral, master, and bachelor programs are listed, and you'll see that W and the M. And so the W stands for Worcester. That means these are the programs that you will find on our Worcester campus. W and M just means that this program is shared between the Worcester campus and the Manchester campus. Do any of you all know how that sharing exists or how that process works?
It's done through distance learning. So, for the PA program, for example, they'll have like their professor in front teaching the class like live, like with them. And then Manchester will zoom in and there's like a couple of screens that the professor can see.
Mm-hmm.
And there's audio that goes both ways. So that if there's a question, say in Manchester, they just say like Manchester question and then the professor can answer it. So it's actually very easy. We don't have
Yeah.
it for PT, but
Yeah, wow, but it's nice to know that our campuses are communicating with each other and we're, not these separate entities, but that we have opportunities to come together. So that's amazing. I love it. Doctor of Physical Therapy program, however, is in Worcester and it is a Worcester campus program. So I want to get Dr. Hune involved in the conversation as we talk about bringing the health sciences together. If you can talk with us a little bit, Dr. Hune, about IPE, what that is, and what does it look like for DP pro, DPT programs. Sorry.
Yeah, sure. So interprofessional education is part of every doctor of physical therapy program. It's part of our accreditation standards. We all have to do it. But what makes it special at MCPHS is those broad array of healthcare programs that you see that we have on campus. So we get to do some really unique IPE experiences that other programs can't do because we have medical sonography on campus. They come into our orthopedic classes and they use their ultrasound machines to show the students ligaments and tendons. We do lectures and classes with the acupuncture program and learn about how dry needling can help with pain or how acupuncture can help with pain. We do things with the occupational therapy. We do them with everybody. So most schools don't have an acupuncture school or medical sonography around. So we get to do some really unique IPEs. We do a balance activity with a school of optometry because balance is not just physical, it's visual as well. So you learn about how to differentiate what of a balance issue is visual and how much of it is a physical body limitation. We work with dental hygiene around the jaw and neck pain. So we get to do some really unique. I've been at several other universities and the IPE education here at MCPH is excellent.
That sounds amazing. And I love the fact that the different disciplines can learn from each other, because that's definitely what the real world is all about, is being able to communicate and work together. So that's fantastic. So MCPHS does provide support services. We want you to know that you are supported. You're not in this alone. So we have what's called CASE, which is the Center of Academic Success and Enrichment. And it is a program basically that provides either academic counseling and support. You can get one-on-one tutoring or group tutoring. You can get a tutorial service from a peer or either from faculty, I believe. Not only that, but you can also get some skills with time management, learning and study strategies. Jordan, tell me a little bit about the support services and how does that work for a typical student?
So I haven't had a ton of experience with CASE, but I do know that obviously it's very readily available to any student who needs it. Say if you are struggling in a class, they will reach out to you, see if you need any support, either with tutoring or maybe having some counseling or anything like that, and they're very much on top of it. So there's
Mhm.
no chance for you to struggle pretty much.
Yeah, and it's okay to raise your hand and say, I need help, and I think as we live in this world, sometimes we feel like it's shameful or there's like this, oh, goodness. No, we are human beings, and this is a very rigorous program. Listen, if you need help, if you need assistance, definitely take advantage of CASE. It is here for you. So thank you for sharing that, Jordan. Okay, so now we're going to get really deep into the meat and potatoes of the DPT program, and that's where Dr. Hune is going to kind of come in and take over from here and talk a little bit about how high impact learning is involved in our DPT program. So, Dr. Hune, take it away.
Okay, so some things that I think are very unique and special about the program and how we try to make learning students feel supported and learning active, and try to lecture not a lot because no student likes to listen to lectures. So we are trying to do a lot more active learning where you are actually working with patients. We have faculty who bring patients from their clinical practice into class so that you can work with them. We have the immediate experiential experiences is a huge highlight of our program. So the program starts in September. By the end of September, you are working with patients in that very first year. So we have these things called integrated clinical experiences. So every Wednesday and Friday morning, you're working with patients. Not alone. We're going to pair you with a licensed PT and a second-year student, a second or third-year student, usually a second-year student. And the two of you together will work with the patient. So you get to review a chart, you get to review their medical records, you get to, talk to the patients, touch the patients, ask them questions, and learn how to interact with patients right away. Because that's almost the toughest thing to learn, is actually working with patients. And a lot of programs don't let you do that until the second year. Not here, you're going to do that right away, but highly supervised. It's very organized, very planned. And the beauty of it too is that you're seeing all sorts of things. You'll go to pediatrics, acquired brain injury, nursing homes, outpatient practices. You get to experience a whole array of where we practice. So that happens beginning year one, and it continues throughout the program. So year one and year two, you'll be doing that. And Jordan can speak to this. When you've got to supervise and teach a DPT-1 student, a first-year student, not only does it help your confidence because you realize how far you've come and how much you learned and how much you know already, but it's also a great review for you to have to step back to year one and review and think like a DPT-1 student again, because you're a whole different student by year two. So you get to teach, you get mentored. There's always faculty present, always a licensed therapist there to help you and answer you questions. They'll review your treatment plans with you, make sure you're not going to do anything harmful, but they'll also give you some freedom to try something. If you have some creative thing you want to try, you can try it. So that's a huge difference for our program. And all those sites that you're going to are out in the community. So it's community service as well. You're going out into the community to do these things. We also have a community service club who does some fabulous things. They did an angel tree around the holidays. We collected all sorts of toys for kids, which was a ton of fun. I was so impressed with how many toys. It literally filled one of our offices. The toys filled our office, which was lovely. The contemporary curriculum, we are revising the entire curriculum now because it's time, and there are so many new things happening in healthcare, post-COVID, long COVID. In Massachusetts, physical therapists can do dry needling. We can't let you do it in school because that's illegal, but we can teach you about it and what it's good for. A lot of programs are moving towards competency-based education, a little more self-directed learning. So we're incorporating all of that into the new curriculum. We're also trying to have you in class less and working with patients more. So right now I said you're out on Wednesday and Friday mornings. We're expanding that to Wednesday and all day Friday. So you get an extra, so a day and a half each week you'll be out in the clinic working with patients. Our faculty are fabulous. We have an orthopedic certified specialist, a sports certified specialist, geriatric certified specialist, pediatric certified specialist, and cardiopulmonary certified specialist. So we have specialists in each range of the practice areas to work with you. Faculty are always available. This is our BMW, our Balance and Movement and Wellness Center, which is our clinic that is on campus. And this is the room where you'll see patients, and you'll also have a lot of your classes. A lot of your lab experiences will be held in here. We're a 3-year, 8-semester year-round program, so you are here for the full 3 years. Your first year right now is a lot of foundational, so you'll learn anatomy, how the body moves, what makes it move, how we walk, all the components of walking, and evidence-based practice, which is how to use research to support what you're doing in the clinic. Year 2 is all patient management, so that's where you learn how to work with patients who are post-stroke or pediatric patients or post-ACL, repair. You learn all of the specialty areas. And then year 3, you're out in the clinic pretty much all year. So it is really a 2-year program that you're in classes. And the 3rd year, you do 3 clinical experiences, each 12 weeks long. 10 or 12 weeks? I think it's 12. 10?
It's 10.
I think it's 10. Yeah, 10 weeks. So 10 weeks in one setting, then 10 weeks in another, 10 weeks in another, and then you graduate. Then you're done. You actually get to graduate. So the first 2 years being year round, including summers, is so that you can spend all of that 3rd year in the clinic.
Wow, that is amazing. And I'm assuming that there is continual support and check-ins with students.
Jordan, maybe a little too much. Yes, we are on top of you. You will have cumulative practical exams. You will have skills checks. We have, not only do you have faculty and student tutors, we also hire professional tutors too. So we hire physical therapists to work with you if you need extra support, because sometimes you just need a little bit more than a student can support you. So we have professional tutors who are able to do that too. You all are, every student is assigned to a faculty coach. So you're going to have somebody on faculty who is your person, and that coach isn't going to tell you how to do things. They're going to encourage you to figure out what works best for you. So we're not going to say just study more. Right? We're going to ask why, we're going to look at your exams with you. We're going to go through those. We have an exam autopsy that we might ask you to do, ask you to, talk to us about how you're studying and give you suggestions for that. Professional tutors, peer tutors, adjunct faculty. The great thing about this program too is our adjunct faculty are all clinicians. They're full-time clinicians, and they leave their clinic to come in to teach with you. So that's how they're able to bring their patients into our classes, which is really nice. Jordan just had patients in neuromuscular, right? That is so much more fun than listening to lectures.
Yeah, it is more fun. I feel like it's more beneficial as well because you're actually able to say feel tone, because if you try to do it on a classmate who's able-bodied, you're not going to be able to feel it. And it's really cool to feel it for the first time and actually know okay, this is what you mean when we do talk about it in class.
Excellent. Right.
So the end of the program culminates in the National Physical Therapy Exam, the NPTE exam. So that's what you have to pass in order to get a license. And we do a lot to prepare you for that. All of your exam questions throughout our NPTE style questions. So we write our test questions in the same style as you'll see in the exam. We will bring in a 2-day review course in your 3rd year in January and they go through a review of everything and talk a lot about test taking strategies. How do you take the exam? This is a 5-hour exam, 4.5 to 5 hour exam. So they'll talk to you about how to do that. We're adding, poor Jordan doesn't even know this yet because we're making the DPT ones do it first. Each semester, you'll have a cumulative exam. So the DPT ones at the end of this spring will have an exam that has questions on it from their fall and their spring. Jordan's class this summer is going to have an exam that has questions on it from all of year 2 and all of year 1. So your exams get longer so that you can practice taking longer exams, such as a 5-hour exam. After the review course, we'll give you 2 practice exams. We also use Final Frontier, which is another program to review that is sort of self-paced that you do on your own. 2 practice exams, support before and after graduation. You can either take the exam in April or in July. But we're going to want to see a passing score on one of those practice exams before we let you take it in April before you graduate. We do a career fair. They just had one in January. We had local clinicians begging to come in. We actually had to turn some of them away. We couldn't fit them all. So our students are in high demand. We'll also talk to you and have residency and fellowship programs come in. Residency is optional for PT. It's something you do after you graduate, but we'll have those programs come in and talk to you. So if you want to specialize in sports physical therapy, you could do a 1-year sports residency. So we'll have those residencies come in and talk to you. And actually, one of the big orthopedic residencies in the area is going to help teach this summer in the orthopedic course, which Jordan will also have.
All right, how exciting.
Yeah.
All right, yeah. And I know that you've gone through quite a bit of this, Dr. Hune, already, just kind of talking about observation versus application and what that looks like in the Balance Movement and Wellness Clinic. Anything else you want to share about this slide or something that we maybe didn't mention?
No, I think this is a highlight of the program that you know, right away you're out talking with patients, and the beauty of it, maybe Jordan can speak to this, is that it's not faculty staring you down and breathing over your neck. It's another student, which makes it a little more comfortable, right? You're less afraid to make a mistake in front of a student than in front of faculty. So it's a very comfortable transition. In that top picture, you see the folks in the middle are the participants that you work on in our clinic on campus. And the other beauty of that is you get to see them. You don't just see them once and they're gone. You get to see them all semester. So you get to see them progress. You get to see them start to do better, which is really nice. It's just why you're going to PT school, right?
It's also a lot of like the same participants come each semester. So it's also really cool to like see how they progress even through like your 2 years in PT school. Because in your second year, you have one participant that you follow for a whole semester. But like you would be able to see like, oh, they started here when I first started, and now I'm seeing them for this whole semester in my second year, and like look at how far they've come. And you also build up such a good rapport with them as well. So it's amazing. I love B&W is my favorite.
They bake you cookies.
They do. And they bring us socks sometimes. We got socks for Valentine's Day. That was really
Oh
sweet.
my goodness. Well, and I've got to tell you, this really is what drew me to this program, the immediate integrated clinical education, because I have received physical therapy personally, and it can be a very traumatic experience. I mean, I fell and I ripped my shoulder to shreds. It was just a mess. And I had to trust my physical therapist. This is a person who is telling me to do these things, and I have to be able to trust them. And she knew exactly what to do, what to say, how to say it. And I think that is so powerful that you all are learning those skills now. You're learning how to connect with patients because they can be scared, they can come in nervous, they come in maybe even angry that they have this injury, and knowing how to connect with them is really makes a difference. So that's my little 2 cents on that, but I really, really think that's fantastic. So these are the clinical, integrated clinical settings. Dr. Hune, do you want to share with us anything about how this relates to our program?
So these are some of the places, and these do change as we get new and different opportunities. So this semester, there's another pediatric place added. These are some of the places that you'll go on those Wednesday and Friday mornings. But again, you're going to see all these different settings. We're going to send you to a hospital, a rehab hospital, a school setting, an early intervention, which is children birth to 3, private practice, home care, and memory care units. So you're going to get to experience all of these. And as I think we've said before, in year 1, you might just be observing in some of these centers. Like we added this year, we have an acquired brain injury setting, and the DPT2s were going, but this year we've added the 3s, but their expectation is just to observe, just to see what it's like to talk to a patient who, may not be able to talk back to you or may have some, issues remembering what you said. So these are changing. These are some of them, but it is, I have to say, this is constantly changing as we find new opportunities.
All right, so this is an example of our Balance Movement Wellness Clinic or Center. Here you can see that the DPT2 students mentor DPT1 students, as we talked about before, performing patient evaluations and designing and implementing plans of care. What I love about this is that you're not just sitting and listening to someone talk all the time. That just would bore me to death. I love the fact that these students are in it. They're, really hands-on learning and doing. And yeah, and this is an actual patient. Am I correct in this
Yes,
slide? Yeah,
actual
yeah.
patient, actual student.
Right. Amazing. Oh, this is one of my favorite parts. So this is the tunnel of love. Does anyone want to talk to our listeners
Jordan, you
about
should.
what this is?
So basically what the Tunnel of Love is, we do it on discharge day from BMW, which is what this video is. And it's just like a cute little way to like send off your patients because like you're celebrating them because like they helped you grow as a PT. We also do it sometimes for like little special occasions, like my class did it during our white coat ceremony and like the beginning of our little journey. So it's just like such a cute little thing.
Well, let's see. Hopefully it'll play for us.
I'm dancing through it. Oh, she's hysterical.
Oh, I love it. I love it. That is amazing. It just, again, is a testament to the relationships that are formed in our physical therapy clinic.
And the video is during COVID. You're not required to wear masks on campus.
Oh, that's right. Okay, I'm glad you mentioned that, Dr. Hume. Thank you. So this is a simulation lab. Explain to us a little bit about what's going on in here and how is this different from the BMW, the physical therapy center?
So this center is set up more like an actual hospital space. So the patients are in a hospital bed. You can see the bottom middle, there's a mannequin that they probably shouldn't be carrying around like that, but that's not. But in this hospital setting, you can have a patient where you can see some of the pictures have all the lines and tubes. So we treat in acute care hospitals too. People could have, lead wires going right into their hearts. They could have NGT tubes. They could have all sorts of devices that you have to take with you when you get them out of bed. So this is a nice setting where you actually get to mimic that because it's really hard to use a walker and carry their IV pole at the same time. So you get to practice those sort of acute, very ill, highly complex patient cases in this setting. This is also where you'll work with nursing because that is a common thing that we do.
Oh, okay. All right. And so the interprofessional education, Dr. Hume, can you, again, we kind of touched on this earlier in the presentation, but if you can just give us a little bit more in-depth information.
So it's very well designed, very organized. It begins again in the fall of your first year, where you'll get together with other first year students from all the other disciplines, and you're all at a table. So there's a table with a PT, an OT, a physician assistant, a nursing student. You're all at the same table, and there are activities designed to help you figure out who can do what. Like, can a pharmacist prescribe exercise? Can a PT inject people with needles? And you have a discussion and you're explaining what you're allowed to do in your role. And so you're learning about the roles of others. And then it progresses into actual clinical experiences. So the glasses they're wearing are designed to mimic, maybe you can't see out of the lateral side of both of your eyes, right? So optometry might be doing that. The Spirit Catches You and You Fall Down is a fabulous book. Highly recommend it for anyone, but it's about healthcare beliefs and how different cultures believe and view healthcare. So the IPE curriculum is a curriculum. It is run from again, your first year through your second year, and it's structured. And this is another thing, I've never seen this happen in another school. Every program has the same chunk of time available so that they can participate in these things.
Wow.
So, from 12 to 1 on Monday and such a date, every program is free so that they can participate, which is a real challenge to do, but it's done here.
Yeah, I was going to ask you, how do all of the disciplines find time, to come together as one? But that's amazing. That just goes to show to you the importance, or the word I'm looking for. Well, anyway,
It's the buy-in from the university about, the importance of this. So
right.
administration is telling every program, you're going to be free, you're going to participate in this, because
Exactly.
it is the way clinical practice actually happens.
Yeah. Perfect. Oh, community service. I love this. I love the fact that we are involved in the Worcester community. So, Jordan or Dr. Hune, if you guys can just share with us what's going on in each picture, if you happen to know where they are or what's happening.
I believe at least two of them are at a senior center, and we led like a Tai Chi class over there.
Mm-hmm.
I believe we're participating in that this summer, so I haven't been there yet.
Mm-hmm.
But there's other like community service things that we do through our integrated clinical experiences. So like BMW is like community service because you're servicing people from the community, and it is a pro bono clinic. So we don't charge for services. But it is a very mutually beneficial relationship because like we're helping them, they help us. Um, Also we go to like retirement community, and we'll do like classes there, and it's a really great experience.
Yeah, yeah,
We'll
good.
do
This
like
looks like, oh, go ahead, Dr.
we'll
Hune.
do balance screens. We may go to an older center and do balance screens, or to a community center. We volunteer with Special Olympics. Like I said, we do with the Angel Tree. We collect gifts for children who may not get gifts. And some of this is tied to faculty research. Faculty members writing a grant now for to work with people with Down syndrome at a gym healthcare program. So some students may get to work there and collecting data with those students. There's a lot. This is another thing that changes as opportunity arises. So somebody may reach out and say, hey, can you help with this? And usually students jump at it and go and do it.
Yeah, that's amazing. Yeah, this looks like the Worcester Senior Center, actually.
We have been there. Yep.
Yeah, yeah, great. All right, looks like some more community service opportunities are represented here as well. Now, I know that this one was the airplane pull for multiple sclerosis, right? And I
Yeah.
think, yeah, so the team that pulled the plane the furthest were able to raise the most money. Is that correct?
Yep.
I think,
I
yeah,
think so. Or
yeah,
whoever moved the plane the most. I can't remember what it
right.
was. The left is
Um,
Special Olympics, I believe.
That
Um,
is Camp No Limits on the
uh,
left. That is
yeah.
a camp that some students go to in the summer. It's usually first year students because second years are out on clinicals when this occurs. But
Mhm.
you work with kids that have limb loss, whether it's congenital or they needed it for surgery. So you work with them and teach them how to use their prosthetics, put them on, take them off. You teach them how to ride a bike, for example, with their
Oh,
prosthetics, and basically like you work with their family too and basically reteach them how to go about everything that they want to do. And then the
yeah.
bottom is we volunteered at a water station during the Boston Marathon.
Marathon, yeah. Wow, Camp No Limit sounds amazing to me. Oh my goodness. And I'm sure that the children are so appreciative of you all going and showing them that. That's amazing. That's great. So research integration is also part of the high impact learning of our program. And it looks like these are some, oops, sorry about that. Looks like these are some examples of research opportunities, University Scholarship Day, um, the APTA conference in San Diego. It looks like Dr. Joyce, if I'm not mistaken, there.
Yep.
And data collection for UMass baseball. Is there anything that you all want to share about research integration?
So
So
Oh,
Go ahead,
you can
Jordan.
go. So especially in my class, I don't know if the first years are doing it this year. But so we basically, the students will assist faculty members in whatever area of research that they're doing. So like we'll go out and do data collection and like we'll interpret data and things like that. Um, so the picture on the right, they went to UMass and worked with the baseball team for strength training stuff. And then you'll be able to, the middle picture, like you'll be able to go to conference and present your research there. Um, and it's a really great opportunity for networking, especially too, if you do go to
Mm,
conference. And it's really great because you're probably going to be doing research as a PT anyway.
right. Yeah, this is a great opportunity. And the outcome. So this is really what it all boils down to. What do you get out of this wonderful program and university that we are attending? So high retention, NPTE pass and employment rates, which we kind of talked a little bit about. There's plenty of clinical residencies and fellowships. From my understanding, you can also become an independent business owner. There's leadership within the national physical therapy community, and graduates can become clinical educators and become adjunct faculty and come back to MCPHS. I've not met a graduate that's an adjunct faculty, but I'm assuming that there are some.
We
Absolutely.
have a couple.
Yeah.
Yeah, that's
You-
amazing. I
Yeah.
love it. I love it. I especially love the leadership within the national physical therapy community because, we sometimes feel like we can only stay in our little bubble, but, learning how to get out there and in your clinical affiliations throughout the country, networking and meeting new people, that's really, really great.
There was a conference last week in Boston with 18,000 physical therapists at it, or 16,000 this year, I think. And several of our students from Jordan's class and our third year students went, and
Mm.
5 of the faculty were presenting at the conference. So it was a nice big conference.
Yeah, yeah, that's amazing. Thank you for sharing that. So this is something that I'm not sure how many of you all know that we do have a bicentennial podcast. And in the 11th episode of the MCPHS Bicentennial Podcast, The Secret to Living to 200 was presented by Dr. Cheryl Babin, who works on our physical therapy team. Is that right, Dr. Hune?
Yes,
Um,
she will help place you in your clinics.
Okay, all right. Well, she explains the vital role that physical therapists play on modern care teams. So I'm not going to read the whole thing because it is quite a bit, but I think it is fantastic for you to um, go to our web page, and if you just type in power of physical therapy, you'll be able to get access to this podcast. It talks so much about the importance of physical therapy and how in the United States, the first physical therapist treated polio in soldiers returning from World War One. Physical therapy is more than just body movement, but it also includes breathing. Who knew? I had no idea. And successful physical therapy often depends on the patient. So I think this is fantastic. I love podcasts, so I recommend you all to definitely go and check this out. Great information. All right, so application for admission. So this is kind of where I come in. When you apply to the physical therapy program, you're going to apply through PT-CAS, which is its own separate entity. All of your documents, all of your transcripts, everything goes through PT-CAS, okay? Once PT-CAS gets everything and they verify your information, they tie it up in a nice little bow and they send it to MCPHS. And then from there, we review all of your documentation. A bachelor's degree needs to either be earned or expected. So you can be in the process of getting your bachelor's degree while you apply, but we need all official college transcripts. So even if you took a class at Quinsig, we still need to see that transcript. Minimum GPA overall, 3.0 on a 4.0 scale. Keep in mind, however, though, that we look at students from a holistic standpoint. And that is one of the reasons why we invite students for an interview, because we want to see who you are behind the application, because someone could have I don't know, maybe a 2.9 or a 2.8. And, they say, oh my goodness, they're not going to take me because I don't have a 3.0. But yet you have like 1,000 PT shadowing experience hours, or maybe you are currently working as a PT aide, or you've done something fantastic in your college career. So we want to hear that. We want to get to know you. And so that's why we look at everyone from a holistic perspective. Now, PT shadowing is required, at least 10 hours. And then completion of prerequisite courses must be completed by August 1st, prior to the start of the program. So like right now, we have students who are already accepted into the program for fall 24, and they're working on their missing prerequisites. 2 letters of recommendation are required. However, 3 is preferred. And if you are an international student, you want to make sure that you complete a WES evaluation, which is World Education Services, and they will evaluate your international transcript and send that to us. And then after that, if we see that you are a qualified candidate, we will invite you for a virtual interview. And like I said before, the interview is just really a dialogue between you and the faculty and myself, just you finding out about us finding out about you, hopefully determining that we are a great fit. So as I mentioned, we have rolling admission, so apply early. Students have been applying since October. I mean, that's just how, how many applications we're getting right now. So if you're interested, please do not hesitate. Important dates, fall 2024 is what we're recruiting for right now. Applications are open. For a competitive application, definitely we're going to look at your cumulative GPA, your prerequisite GPA, but we also are going to look at your interests. We're going to read your personal statement, your experiences, what motivates you. Also, your interview, if you're invited to an interview, that is a part of the application process, believe it or not. So you definitely want to make sure that you present your very best in your interview. And then I encourage a campus visit. I think if you come to the campus and you tour the campus, you get a better understanding of what we offer and get a chance to take a look at our facilities, which I think is really important. When it comes to financial aid, all domestic students with a valid FAFSA on file will be considered for federal aid. Right now, FAFSA is going through some changes, some reconstruction, and it's throughout the entire country. It's not just at MCPHS. So they're really behind on getting those award letters out. So if you have completed a FAFSA and you have not heard anything yet, don't panic. You can always contact Student Financial Services and ask for Lynn Berry, who's the representative for our physical therapy program, and he can do what's called an affordability appointment. And then you can talk with him about FAFSA and merit scholarship. How much were you awarded and how does all that work together? Housing and everything. So that is a huge piece of your start. And that brings us to the end of our presentation. We hope to welcome you to our community soon. we really hope that you take advantage of our campus tour, come and look at our PT clinic that we have. We would love to see you in person. Uh-oh, what did I do? Okay. Now, do we have any questions? I don't see anything in the Q&A chat. So I don't know if there's any questions for me, Dr. Hune or Jordan. If there aren't any questions, then we must have really done a great job, ladies. That's the only thing I can think of. But again, I encourage you to please have a counselor appointment scheduled with me if you want to go over your transcript or your prerequisites. And before we finish, I would like for Dr. Hune and Jordan. Oh, we have a question. Someone raised their hand. Joshua. Um, okay, Joshua, you're with us.
Can you hear me all right?
Yes.
Okay, great. I was wondering how to like navigate. So my question is about the prerequisite materials. So you listed that you required, or the school requires WES evaluation.
Mm-hmm.
So if I'm, because I'm actually originally from Canada, and my transcript was evaluated using a different program, a different service, and it was sufficient to get my credits authenticated here in the community college where I am. I'm currently attending Middlesex Community College here in Lowell, and I'm just
Mm-hmm.
wondering if you would still require that evaluation, like it would just not be authenticated with no other evaluation.
And you said this is a Canadian transcript?
Yes, it is. Yeah.
Okay, so yeah, you and I can definitely talk more in private about that, because with Canada, it's definitely a different bag of apples in a good way. So I don't know if you have my contact information.
I have actually received your email, so okay, it's right here as well too.
Yeah, so definitely send me an email and let's schedule an appointment so that way I can talk with you more in depth about that.
That sounds great. Thank you very much, Jen.
Yeah, but thank you for asking, Joshua. Yeah, sure.
Thank you.
You're welcome. Any other questions? Well, Dr. Hune, if there's any advice you can think of to give our listeners, what would it be?
Physical therapy is the greatest field ever.
I
But apply
concur.
early. Apply
Yes,
early.
yes,
Don't be afraid to reach out to any of us with questions.
absolutely. Okay, Jordan, what about you from a student perspective? What would be your advice?
Definitely don't let, like, if you do have missing prerequisite, definitely don't let it get in the way of you applying. I even had a missing prerequisite when I first applied, and I still got accepted on the terms that I just finished it before the start of the semester. And obviously I'm here and doing well. So definitely don't let it stop you from applying, especially if this is something that you really want to do.
Yeah, I agree. And then from an admission standpoint, my I would say communicate, communicate, communicate. I mean, you can't send me too many emails. You know, you can't call me enough. This is a huge decision you're making. You know, this is big. So I want you to communicate with me. Call me, email me. I want to be there for you to answer your questions. and make sure that we're all on the same page and that I'm here to assist you in any way that I can. And with that being said, we are going to end our info session. Thank you so much for spending time with us. We enjoyed having you, and I look forward to hearing from each of you. Have a good evening.
Good night.
Good night.